aphasias. A person's inability to communicate is called aphasia. A person's inability to communicate verbally is called aphasia. It is a language disorder. He is not able to speak properly, so he is not able to communicate properly. Okay. Now, if you talk about aphasias, especially the neurologists, they say there are two types of aphasias in the neurology wards, in the stroke wards or in the trauma wards, where they call motor aphasia and sensory aphasia. So let us understand what exactly is this motor aphasias and sensory aphasias. For that we have to go with what is the motor area and what is the sensory area. Now, what is the motor area? In the left cerebral hemisphere, over the superolateral surface of the cerebral hemisphere, there is a lateral sulcus which is having posterior ramus, having a anterior ascending ramus and anterior horizontal ramus. So here you have got area number 44 and 45, which are called pars opercularis and pars triangularis. Together these constitute the Broca's area of speech, which is the motor speech area, that is responsible for the production of the sound, production of the words, and then that is the site where response is given for what is being understood. Now, where is that being understood? When we speak, somebody is understanding. So that understanding is possible because of area number 22, which is seen in the posterior aspect of the superior temporal gyrus, and this is called Wernicke's area or the sensory area of speech. When somebody is talking, we are able to understand because of the intact Wernicke's area. The comprehension is because of this. Now, connecting this sensory area with the motor area, you have got arcuate fasciculus or superior longitudinal fasciculus. The Latin meaning of arcuate fasciculus means a curved bundle. So this is connecting the sensory area with the motor area. So when we talk, the comprehension and understandability is in the Wernicke's area, and accordingly the answer is being given. Why? The Broca's area of speech. For example, if somebody asks, what is your name? Understood by area number 22 and area number 44, 45, that is Broca's area is giving the answer, my name is Shrikant. Okay. But if there is injury to the Wernicke's area or the sensory area, then the person develops sensory aphasia, wherein he is not able to understand what is being questioned, what is being asked. And also, along with the Wernicke's area, if there is a disturbance with the arcuate fasciculus or the superior longitudinal fasciculus, then the person will have jargon aphasia or the fluent aphasia, you can talk, wherein the person is in an elevated mode, the patient. Whatever you ask, he is going to respond very briskly but irrelevantly. What he is talking is irrelevant, making no sense for the question what you have asked him. For example, if you ask, what is your name? He will answer, I am fine, I am fine. Did you have your breakfast? I am fine, I am fine. So this is how he is again and again repeating the same sentence for any question which you ask. If you ask 10 different questions, the answer will be the same. And that's what we call echolalia, repetition of the same sentence again and again. Because the patient is unaware of the defect, he is happy, he is elevated. Now coming to the injury in the Broca's area. If the Broca's area number 44, 45 are injured, then the patient is having hesitation of the speech. That is, when you ask him a question, what is your name? And his Broca's area, when he is injured, he is having hesitation. He is understanding your question, but he is not able to talk, he is not able to speak. There is no articulation of the sound. And then tears are rolling out of his eyes because he is aware of his defect. He is in distress, he is upset. Okay? But the patient with motor aphasia, if you show him a chalk, he can tell it is for writing. If you show him a key, he will tell it is for opening a lock. If you show him his son, he will identify he is my son. So his IQ is normal, but only ability to communicate verbally is challenged. Then, if there is injury to this arcuate fasciculus or the superior longitudinal bundle, the patient will have conduction aphasia. In this conduction aphasia, he is not able to read, and that is called alexia. Not able to write, it is called agraphia. So there is alexia and agraphia when this arcuate fasciculus is being injured, and that is called conduction aphasia. Now you have something called paraphasia, a condition in which the patient is using the rhyming words or the similar words. He is not using the apt word. For example, if the person is seeing a cat, he will tell that is rat or that is bat. Or if you ask what is this number 45, he will call it as party 5. Okay. And if you say institution, he may say constitution, because these words are rhyming, similar. Thank you.